Hi, everyone. I'm Twyla Warlock. I'm the graduate teaching assistant for Wendy for 360. So, I just wanted to talk to you today about theory for a few minutes. That's what our topic is this week. You will find that you use theory basically throughout your nursing career. So, my thinking on theory, my advice is to find one of these theorists that you actually identify with, that your nursing practice identifies with, um, something about that theory that draws you in because you will use your theory, especially being in school. Your bachelor's program, you will use it, especially when you're writing papers, things like that. It gives you something to build on throughout your career, basically. And it's really interesting. You will find, like, when you enter, or if you go even further than your bachelor's, you could possibly do a master's or your DNP or PhD. And if you do that, when you fill out your application and they ask you about which theorist that you identify with, it really makes you stop and think if you've been in practice for a long time. So for me, I had practiced anesthesia for years, and I thought, oh my gosh, I don't know, I've got to review it. So I did, and I realized that Betty Newman was who I identified with, and I identified with her early on. All my patients basically were under stress. Anytime you have surgery, it's a stressful situation. So I was very, it was just easy to get that theory in my head basically and stick with it. And I didn't even realize how it had become part of my practice. And so it was really interesting to look back, review, and then write about it after all these years. So I know now that's who I based my practice on. And so it's really interesting. So you will find on page 82 of your book, there is a table that I want you to look at. And it lists several of the theories. And I'm not going to go over every one of these theories with you because you're going to read this chapter. But I want you to look at, like, some of these theories are grand theories, and the grand theories are the ones that are more realistic with many ideas that bring everything together. And the more abstract that the theory is, the further out it becomes, like it becomes mid range, and then it's a practice theory. So pay attention to that as you go on through your chapter. And I want you to really look at, in the end, it talks about Maslow's hierarchy of needs, his theory. I just think that is an excellent theory because this applies to everyone. It applies to all of your patients. It applies to psych, which I actually teach 462 right now, and hopefully I will continue after this term when I finish my DMP. Um, and this is a theory that I think of in psych a lot because some of our clients and our patients and your patients that you deal with now, they can't reach the top of this pyramid of self actualization until they have their needs met at the bottom of shelter and food and things like that. So, this theory and knowing about that, it's really important. You don't go straight to self actualization with someone without going through these steps. So I think that it's really important to know your theory and to build on it, and especially certain theories like this that you use no matter what. there's going to be some of these theorists that you identify with that you can bring into your practice, and not all of them, maybe one or two, but there's going to be certain theories that apply to everyone. So pay attention to that and see what you think. Um, there's also something in the back of the chapter. It talks about theory being related to disciplines like in research and education and in nursing. So I want you to realize that there's going to be theory throughout your life and your career. And I posted a PowerPoint about adult learning theory, and it's not covered in this chapter, and it's something that came out later on than some of these theories. However, I realized it's something that can benefit you because as a nurse, we do teach adults daily, our patients, and even if we work in pediatrics, their patients, I mean, their parents are adults who you actually do the teaching to for your pediatric patients. So, across the board, we're going to have patients that are adult learners, and it's nice to know how they process this information. And as you go along through school, and if you even teach someday, it's nice to know how you process this information and how possibly your students process this information. So I think it's interesting to look at that adult learning theory and just check it out and look over that. Also, there's a little video, YouTube video posted that kind of goes over some of the nursing theorists and their theories in a lighthearted manner that you might look at or that do look at. It's just a way of looking at these theories to be able to kind of make them stick in your head. Because right now you're just possibly learning all this stuff for the first time. I don't know if you learned it in your associate's degree program or not, but if you did, it may have been something that you just kind of breezed over, and now you're going to learn it again. Then, when you go on through different classes, you're going to learn different parts of it again. And then, when you get in your next program, say for your doctorate or your master's, you're going to learn it again. So, just know that it's something important that you base your knowledge on and through. And this lecture has been kind of fun for me teaching you about this. And I actually, it's been kind of nice teaching online because, lecturing is still something that I'm getting used to. After years of anesthesia, I never saw myself teaching, but I actually really like it. So I'm hoping to stick with it for a long time. Hopefully, you got something out of this, but if not, well, hopefully you did. That we'll stick with that. If you guys have any questions, feel free to contact me, text me, email me, or contact Wendy, the main instructor for this course, and I will see you next week. Okay, you guys enjoy your week. Bye bye.